Now we discuss the applicable examples in TCM of the yin-yang theory. Number one, it interprets the structure of the human body. All the tissues and organs in the body are not only organically related to each other, but are also categorized into two parts of yin and yang. Generally speaking, the upper part of the body pertains to yang, while the lower part to yin. The exterior of the body belongs to yang, while the interior of the body to yin. The back pertains to yang, while the abdomen to yin. The lateral side of the forelimbs pertain to yang, while the medial side to yin. When considering the functions of the viscera, the five Zhang viscera pertain to yin because they store the essence, but do not transport and transform food. The six Fu viscera pertain to yang because they transport and transform food, but do not store essence. Among the five Zhang viscera, the heart and lung are located in the upper, the thorax, so they pertain to yang, while the liver, spleen, and kidney are located in the lower, the abdomen, so they pertain to yin. Each viscera itself can be further divided into yin and yang aspects, such as heart yin and heart yang, kidney yin and kidney yang. Overall speaking, every part of the human body, superior, inferior, internal, external, interior, exterior, and anterior, posterior, as well as the inner organs, may all be applied by yin-yang theory. Second, it explains the physiological functions. The coordination and balance of yin and yang result in normal human life activity. In terms of substances and functional activities, their relationship embodies the unity of the opposite aspects of yin-yang. The physiological function of the human body is based on the substances of the body. Without the movement of the substances, there would be no physiological function. On the one hand, the physiological activities consume energy and substances, but on the other hand, they constantly promote metabolism as well as receive and store the energy. Once the physiological activities are blocked to function normally, it will affect the normal metabolism. Therefore, the relationship between the physiological activities and substances is the process of mutual restriction, production, as well as waxing and waning of yin-yang. From the point of view of qi and blood, qi belongs to yang, while blood belongs to yin. And qi can generate, move, and control blood. Therefore, the normal function of qi helps the blood to have the normal production and circulation. Blood can generate and hold qi. Therefore, the abundance of blood can promote qi's normal function. The correlation between qi and blood reveals the mutual rooting and interdependence of yin-yang. Third is to explain the pathological changes. The harmony and balance between yin-yang in Chinese medicine is considered as healthy symbol, whereas the imbalance of yin-yang is regarded as the basic reason of the occurrence, development, and change of the disease. The mutual rooting and restriction of yin-yang exist in the state of constant waxing and waning. The imbalance of yin-yang will result in the excess or deficiency that causes the diseases, which is called the disharmony of yin-yang. On further analysis, the occurrence and development of disease mainly involve the two aspects, vital qi and pathogenic qi. The vital qi is classified into yang qi and yin fluid, while the pathogenic qi is classified into yin and yang pathogens. For example, in the 6 climatic pathogens, cold and damp belong to the yin pathogen, while wind, summer heat, and fire belong to yang pathogen. The process of the occurrence, development, and change of the disease is a process of conflict between the vital qi and the pathogenic qi. The conditions reflected by the interaction and mutual conflict between the vital qi and the pathogenic qi can all be explained by excess or deficiency of yin-yang, namely the imbalance as well as the waxing and waning of yin and yang. Excess of yin or yang refers to the pathological change due to the excessive yin or yang. Generally speaking, the predominant part belongs to the pathogenic qi, while the deficient part belongs to the vital qi that includes yin fluid or yang qi. The pathological changes generally have the following categories, and we will discuss this in our next session. Thank you for your attention.
Let's continue with interviewing. And for today, we talk about abnormal urination. So first, we talk about the definitions. Urine we define as the waste of water metabolism. Excessive urination is a significant increase in the volume of urine, possibly accompanied by frequency. In enuresis, there is spontaneous urination while sleeping, although good control while awake. This is usually seen in children. Dysuria means a mild condition that suggests difficult urination. The urine passes only as drops and in small quantity overall. It is usually a chronic condition. Anuria is a severe condition in which there is an absence of discharged urine. Even though there is an urge to urinate, it is usually an acute condition. Although there are some differences between dysuria and anuria, they both refer to difficulty in eliminating urine, and thus the two words together, long B, are simply translated as urinary blockage. So let's go to the physiology of the formation of urine. The formation of urine is governed by the bladder and closely related to the lungs, spleen, stomach, small intestine, kidney, liver, and the triple burner. The stomach receives and absorbs the fluids. The spleen transforms the fluids into water essence and transports it to the lung, which distributes the water essence to the entire body to nourish the organs and tissues. The water that isn't absorbed by the stomach is transported to the small intestine, and this organ separates the clear from the turbid, reabsorbs the clear, and transports it to the spleen, where it then rises to the lung. The turbid pours down the bladder where it is eliminated. The dispersing and draining function of the liver and the warming function of the kidney also play an important role in the process of water metabolism. Here is the diagram of the physiology of the urine formation discussed earlier. So, in normal urination, a normal person passes urine 4 to 6 times during the day and either not at all or just once at night. The amount of urine per day is 1,500 to 2,000 ml, and the color is a clear yellow. The frequency, color, and quantity of urination are influenced by fluid intake, air temperature, sweating, and age. The scope of inquiry about urination. So, inquiring about urination should include the following: urine color, odor, time and frequency of urination, quantity of urine, feeling during urination, and other accompanying symptoms. So to summarize, abnormal urination can arise due to Zangfo organ dysfunction, deficiency of body fluids, dysfunction of the functional activity of qi, and water retention. The types of abnormal urination can be classified by quantity, frequency, color, or problems of elimination. So in abnormal urination, let's take a look at change in quantity, if there is excessive urination or scant urination. So if there is change in frequency, if there is frequent urination, if there is nocturnal urination. So we also take a look in change in color. It's yellow urine, turbid urine, red urine, or clear urine. And finally, if there is a change in elimination, so if there is burning pain, if there is dripping of urine, if there is urinary incontinence, if there is enuresis or dysuria and anuria. Okay. Thank you for your attention.
Let's discuss diagnosis according to the pathogenic qi, exogenous dampness part 2. For the treatment principle, we have to expel and transform dampness, regulate qi, and possibly drain heat. For the acupuncture points, choose from spleen 6, spleen 9, red 9, and UB22. If there is an invasion of damp heat in the weight qi level, add Sanjiao 5, Li4, Li11, Do14, UB12. If there is an invasion of wind damp, add Lang 7, Li4, Sanjiao 6, GB31, and UB12. If there is an invasion of damp in the stomach, add stomach 21, stomach 34, stomach 36, and REN 12. If there is an invasion of damp heat in the stomach, add stomach 21, stomach 34, stomach 36, stomach 44, Li11, and REN 12. If there is an invasion of dampness in the intestine, add stomach 25, stomach 37, stomach 39. If there is an invasion of damp heat in the intestine, add stomach 25, stomach 37, stomach 39, stomach 44, Li11. If there is an invasion of dampness in the urinary bladder, add REN 3. If there's an invasion of damp heat in the urinary bladder, add REN 3, UB39, and Li11. If there's an invasion of damp heat in the gallbladder, add GB24, GB34, and GB36. If there is an invasion of dampness in the uterus, add PC pericardium 6, Sanjiao 5, GB26, GB41, and REN 2. If there's an invasion of damp heat in the uterus, add Li11, pericardium 6, Sanjiao 5, GB26, GB41, and REN 2. If there is a damp B, add local and distal points on the relevant channel. If there is heat, also add Li11 and Do14. Needle technique training. For the explanation, we spleen 6, spleen 9, REN 9, and UB22 all drain and transform dampness. Lung 7, Sanjiao 5, Li4, Li11, Do14, UB12 expel exogenous pathogenic qi and activate weak qi. GB31, Sanjiao 6, expel wind from the skin and stop itching. Stomach 21, stomach 34, stomach 36, and REN 12 regulate stomach qi. Stomach 25, stomach 37, and stomach 39 regulate qi in the intestine. Li11 expel and drains damp heat. Stomach 44 drains damp heat. Do14 drains heat. REN 3 drains dampness and damp heat from the urinary bladder. UB39 drains damp heat from the urinary bladder. GB24, GB34, GB36 drain damp heat from the gallbladder and regulate gallbladder qi. Sanjiao 5, GB41 open Daimai and drain dampness and damp heat. GB26 drains dampness and damp heat from Daimai. REN 2 drains dampness and damp heat from the uterus. Relevant advice: when there is an invasion of dampness, it is important that the person does not consume food and beverages that can contribute to the condition of dampness. This means that they should not consume dairy products, cold drinks, ice cream, sweet, dry fruit, cakes, wheat flour, sugar, lettuce, cucumber, tomato, melon, avocado, and tropical fruit. Furthermore, if there is damp heat, they should avoid alcohol, hot spices including chili, and fried food. An invasion of dampness can be caused by the following pattern of imbalance: spleen qi deficiency. And an invasion of dampness can result in the following pattern of imbalance: spleen qi deficiency and phlegm. Thank you for your.
Let's proceed to diagnosis according to 6 stages. This time we discuss Taiyang Fu, accumulation of water. This is one of the 2 organ patterns that Zhang Zhong Qing differentiated in the Taiyang stage. Pathogenic qi can sometimes transmit directly from the channel level to the Fu organ. There will, though, still be signs that there is an invasion of the exterior aspect of the body. Wei qi, which circulates in the exterior aspect of the body, is disrupted, meaning that the person will have an aversion to cold and the pulse will be superficial. The urinary bladder and to some extent the small intestine will have been disturbed by the presence of exogenous pathogenic qi. This can be seen in the fact that their functions are disrupted. There can be retention of urine, painful urination, acute edema, and watery vomiting after consumption of fluids because the exogenous cold blocks transformation and transport of fluids in the body. Cold can transform into heat. This can result in signs such as fever, thirst, and a rapid pulse. Etiology, invasion of wind and cold. Symptoms and signs, acute edema, aversion to cold, slight fever, slight thirst, watery vomiting after consuming fluids, painful urination, retention of urine, irritability, superficial and rapid pulse. Key symptoms are acute edema, retention of urine, aversion to cold, superficial pulse. Treatment principle: expel wind cold, regulate urinary bladder, drain fluids. Acupuncture points to choose from are REN 3, REN 9, lung 7, spleen 9, bladder 22, and bladder 39. Needle technique is draining. REN 3, REN 9, spleen 9, bladder 22, and bladder 39 regulate the water passages and drain fluids. Lung 7 regulates water passages and expels wind cold. When there is invasion of wind cold affecting the Tai Yang Fu, the person should drink hot, spicy drinks such as a whiskey toddy, hot ginger tea, or an infusion of garlic, cayenne pepper, ginger, and honey. They should then wrap themselves up in blankets or quilts to induce a sweat. They should avoid eating heavy meals. Taiyang Fu accumulation of water can be caused by Taiyang channel invasion patterns. Taiyang Fu accumulation of water can lead to Taiyang Fu accumulation of blood. Thank you for your attention.
We continue with treatment principles with another case history. The patient is a woman aged 72. She had been suffering from chronic bronchitis and emphysema for a very long time. She caught colds easily, was breathless, and coughed up a lot of sticky yellow sputum. Her pulse is slippery and both front positions are weak. Her tongue is red with sticky yellow coating. During the course of treatment, she caught a heavy cold and had the following symptoms: aversion to cold, a headache, cough, runny nose, sneezing, breathlessness, and a floating pulse. So for the diagnosis, there is retention of phlegm heat in the lungs and spleen qi deficiency. During the acute exterior attack, there is invasion of the lungs' defensive qi portion by exterior wind cold. So to explain the diagnosis, this condition is chronic, and as often happens in chronic conditions, there is interior heat. There is also phlegm, which is caused by deficient spleen qi being unable to transform fluids, which accumulates into phlegm. The spleen qi deficiency is the root, and the retention of phlegm in the lungs is the manifestation. The upright qi is weak, and there is a pathogenic factor in the form of phlegm heat. Hence, the condition is a mixed, deficient, and excess one. The acute attack of wind cold represents another root causing the various clinical manifestations. So for the treatment principle, treatment must primarily be aimed at the root, that is tonifying spleen qi, because as long as the spleen is weak, new phlegm will always be formed. However, the clinical manifestations are in this case severe and distressing and also need treatment. So in this case, both the root and the manifestation need to be treated simultaneously, and the treatment must combine tonifying the upright chi, in this case the spleen chi, with resolving the pathogenic factor, in this case the phlegm heat. During the acute attack of common cold, the treatment principle is entirely different. In this case, treatment of the acute condition takes precedence over the chronic one, as this patient has emphysema and chronic bronchitis, and therefore an exterior attack of wind cold can have a very serious consequences if not treated promptly. The wind cold attack, for instance, could very easily turn into pneumonia, considering the tendency to lung trouble and the retention of phlegm heat in the lungs. During the acute attack of wind cold, the primary aim of treatment is to expel the pathogenic factor first and tonify the upright chi later. Points used to expel wind cold were lung 7 and bladder 12 with cupping. Thank you for your attention.
Let's discuss diagnosis according to Sangfu organ pattern, the large intestine dryness. This imbalance pattern is a precursor of yin deficiency. There will be a perceptible symptoms and sign of dryness, but not decidedly yin deficiency symptoms and signs. For the etiology, this pattern may be due to exogenous dryness, which can arise when a person is living in a very hot and dry climate. The most common cause, though, is irregular diet, eating late, eating while working, irregular eating, or eating while stressed will all injure the stomach yin, which is the root of yin. For the symptoms and signs, there is dry pellet-like stools, difficulty defecating, dry mouth and throat, dry skin, thin body, thin and dry tongue, fine pulse. The key symptoms is dry pellet-like stools. For the treatment principle, moisten and activate the large intestine. For the acupuncture points, choose from stomach 25, stomach 36, stomach 37, spleen 6, spleen 15, REN 4, REN 12, kidney 6, and UB 25. Needle technique, we have to tonify. For the explanation, stomach 25, stomach 37, spleen 15, and UB 25, moisten and activate the large intestine. Stomach 36 and REN 12 nourished stomach yin. Spleen 6, kidney 6, and REN 4 nourished yin. For the relevant advice, when there is a large intestine dryness, the patient should eat foods that are moistening and lubricating. This includes foods that are rich in oils, fats, such as nuts and seeds, as well as vegetable oil. Prunes, bananas, avocado, spinach, and plants from the cabbage family moisten and lubricate the intestine. Large intestine dryness can be caused by the following pattern of imbalance: the stomach yin deficiency. The large intestine dryness can result in the following pattern of imbalance, which is the yin deficiency. For the summary, the large intestine yin deficiency with dryness, the etiology, a lack of blood and body fluid with underlying blood or yin deficiency leading to exhaustion of fluids in the large intestine. A warm, dry climate, postpartum blood deficiency, liquid depletion in the age and enduring and severe disease, externally contracted febrile disease. For the signs and symptoms, there is dry, hard stool which are difficult to move, dry mouth and throat, thin body, bad breath, dizziness, generally no abdominal distension or pain. The pulse is fine, the tongue is dry and peeled, can be pale or red. The treatment principle is to supplement yin, promote fluids, regulate intestine, and wound stagnation. For the acupuncture points, we use stomach 36, promotes yang min fluids, Kidney 6, supplement yin, promotes fluid. Stomach 25 regulates the intestine. Bladder 20 benefits the spleen transformation. Bladder 25 regulates the large intestine, transforms stagnation. Spleen 6 supplements yin, promotes fluids. Ren 4 supplements yin, promotes fluid. Bladder 17 harmonizes the stomach chi. Bladder 21 supports centered chi to supplement deficiency. Needle with supplementation and maybe moxa if needed. Thank you for your attention.
We discuss yang deficiency under diagnosis according to 8 principles. When there is yang deficiency, the body's fundamental warming, activating, and energizing aspect is weak. This will manifest as tiredness, feeling cold, and lacking motivation. The person will be mentally and physically lethargic. Their body movements will be slow and limp, and they will possibly drag their feet slightly when walking. The deficient yang will fail to lift the body upwards and counter gravity. This means that the person might be slightly slouched or that they will have a poor posture, the upper part of the body being slumped forward. A person who is yang deficient will need to wear warmer clothes than other people in order to keep warm. They will typically have cold limbs. The lack of heat in the body will manifest with a preference for hot food and beverages. Their face will typically have a pale color due to the lack of warmth and because yang qi is not strong enough to send blood up to the head. Transformation and transportation of fluids in the body will be impaired when there is yang deficiency and yang is not capable of performing its functions. This will result in there being an increased volume of urine, which is clear in color. There will be frequent urination because of the increased volume of urine and because kidney yang is too weak to keep the urine inside the urinary bladder. Yang qi also helps to keep the sweat inside the body. Yang deficiency can therefore manifest with spontaneous sweating or sweating on light activity. The disruption of fluid physiology will also be seen in a lack of thirst, and there can be a tendency to edema. Yang is utilized in transformation of food that has been ingested. If yang is deficient, the person may have not only loose stools, which is typical of qi deficiency, but also watery stools, possibly containing undigested food particles. This is because the food and liquids consumed have not been transformed. Tongue will be swollen and pale, and pulse will be deep and weak. The organs most likely to be yang deficient are kidney, spleen, and heart. There will be tangible symptoms and signs that specifically relate to these organs' active functions if they are yang deficient. Yang deficiency can arise when yang has been overstrained through prolonged overexertion, old age, recurring cold invasions, improper diet, disease, or congenital weakness. Symptoms and signs are feeling cold or aversion to cold, cold limbs, frequent urination, clear and copious amounts of urine, edema, loose watery stools, possibly containing undigested food, mental and physical fatigue, slow and lethargic body movements, slumped posture, spontaneous sweating, lack of thirst, preference for hot drinks and hot food, pale white face, pale swollen and possibly wet tongue, deep or weak pulse. Key symptoms: aversion to cold, fatigue, pale and swollen tongue, deep or weak pulse. Treatment principle: tonify and warm yang. We choose from the following acupuncture points: Du 4, bladder 23, Ren 4, Ren 6, kidney 3, and kidney 7. Needling technique is tonifying, moxa recommended. Bladder 23, Du 4, Ren 4, Ren 6, kidney 3, and kidney 7, tonify and warm kidney yang. A person who is yang deficient should consume a diet that is warm, both in its physical temperature and energetic dynamic. They should try to avoid completely food that has a cooling quality, including food and beverages that are physically cold. This is especially relevant during the winter. This means that they should avoid fruit unless it is stewed or baked and have no salads, raw vegetables, or cold drinks. They should try to use more warming cooking methods such as baked and grilled dishes. A good start to the day would be to eat hot porridge with a sprinkling of cinnamon. Hot spices such as chili and cayenne pepper are not necessarily a good idea, though, as they will cause the person to sweat and thereby lose heat and yang qi. Replenishing a deficient condition is something that takes time and cannot be forced. Generally, spices in the diet will be beneficial as they will awaken yang. Exercise is important, but care must be taken. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. However, the person must be careful that they do not train too hard. Otherwise, they will consume their yang qi. Starting the day with activities that can awaken and get qi moving, such as stretching and shaking the body, is a good idea. Keeping warm is important, especially the lumbar area and the area just below the navel. Something that can be recommended is for the patient to wear a woolen belly warmer. Alternatively, they can tie a scarf or a shawl around their abdomen. No matter what, they should try to avoid these areas becoming exposed to the cold or drops. A ginger or mustard foot bath is also something that can be recommended. It will also be beneficial for them to drink ginger tea during the day. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and weaken yang. Apart from the general advice given, men should avoid having too much sex, including masturbation, because yang is expended in the ejaculation and because the semen contains jing, which in the end is the root of kidney yang. Lifting heavy objects weakens kidney yang, so this should be avoided as much as possible. So let us now take note of the difference between excess conditions and deficient conditions. Excess conditions, the pathogenic qi is present or there is stagnation of qi, blood, or qinye, can be either acute or chronic, overactivity, or a stagnation of an organ's qi or a vital substance. If there is fatigue, it will be relieved by activity. Symptoms often improve with physical activity. The symptoms are severe, the pulse is strong. Under deficient conditions, there will be deficiency of qi, blood, qinye, yin, or yang. And deficiency conditions are usually chronic, lower level of functional activity in an organ or of a vital substance. Fatigue, exacerbated by activity, symptoms often worsen with physical activity and when the person is tired. Symptoms are milder, pulse is weak. Excess conditions will have thick tongue coating. There will be pain or discomfort exacerbated by palpation and loud voice. While in deficient conditions, the tongue coating is normal or lack of tongue coating. Pain and discomfort relieved by palpation and the voice is weak. Thank you for your attention.
Let's discuss the depression with the pattern kidney and heart yin deficiency, empty heat blazing. In kidney and heart yin deficiency and empty heat blazing, the clinical manifestations are as follows: depression, anxiety in the evening, feeling hot, malar flash, dizziness, palpitations, waking up at night, 5-pound heat, night sweating, mental restlessness, nocturnal emissions with dreams, and sore back. The tongue is red without coating, and the pulse is floating empty or fine and very slightly wiry. Now let's take a look at its pathology and mental emotional pattern. This pattern is characterized by deficiency of yin of the kidneys and heart and by empty heat of the heart. The deficiency of yin of the kidneys leads to empty heat, which blazes upward to affect the heart. This combination of patterns is more common in the middle age or elderly. The deficiency of yin itself causes the patient to become depressed, while the empty heart Empty heat harasses the mind and the ethereal soul, causing the person to become anxious and restless. An important sign for this combination of patterns is a red tongue without coating. So we have to take note that it is the lack of coating and not its redness on the tongue that indicates yin deficiency. A tongue without coating indicates yin deficiency, and a red tongue without coating indicates yin deficiency with empty heat. The patient's profile in this pattern is that the pattern of kidney heart yin deficiency with heart empty heat is more common in middle-aged or elderly patients. It is usually due to worry, fear, sadness, guilt, or grief. For the treatment principle, we nourish kidney and heart yin, clear heart empty heat, calm the mind, and lift the mood. So for the acupuncture points, we use kidney 3, kidney 6, spleen 6, kidney 2, kidney 9, bladder 52, heart 6, pericardium 7, do 24, do 19, and REN 15, with reinforcing method on all the points except kidney 2, heart 6, and pericardium 7, which should be needled with even method. Kidney 3, kidney 6, and spleen 6 nourish the kidney yin. Kidney 2 clears empty heat. Kidney 9 nourishes kidney yin and calms the mind. Bladder 52 strengthens the willpower. Heart 6 and pericardium 7 clears heart empty heat. And do 4, do 19, and REN 15 calm the mind. Thank you for your attention.